We is live once again for another episode of Mind, Your Body, and Soul, the Healthy Podcast, and it's hosted by myself, Joseph Ward, and Mr. Mathias Sweet. What's going on, Mathias?
Nothing much, just working.
Yes, sir. And we want to give a shout out to our guest host, Miss Elena Steeple, who joins us time to time to drop some information on you all. Remember, Mind, Your Body, and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And remember, you can catch our podcast every Wednesday, like today. Every Wednesday, you can either visit our home base, our website at nmcpodcast.com, or you can find us on anchor.fm, Breaker, Radio Public, Podcast, Pocket Cast, Spotify, Google Podcasts, as well as our YouTube channel. Make sure you subscribe to the Neighborhood Medical Center YouTube channel. That way you will be able to see all of our podcasts as well as our healthy happy hours. And we do want to remind you that Neighborhood Medical Center, our Ryan White team, we provide you with a healthy happy hour. Now during COVID, it's a virtual experience every third Thursday of every month. So you can come to our YouTube channel and see the previous healthy happy hours that we have recorded. We do want to make sure that we send a shout out because it was National Pharmacist Week.
Yep, that's it.
Yeah. So with it being National Pharmacist Week, first want to start in-house and say, give a shout out and a thank you to our resident pharmacist, Dr. Otis Kirksey, for all the great things that he do for our organization and for our community. So thank you, Dr. Kirksey. We also want to give a shout out to all of the pharmacists that we know, but especially our two pharmacists that we were able to record on this podcast, Dr. Brianna Journay and Dr. Danielle Williams. And y'all make sure y'all go check their podcast out because drop real good information.
That's right. That's right.
Do want to make sure we got that going on. So, Mathias, man, what you got going on today? How you doing today, bro?
I'm good. I'm good. Just living life, making it to the fullest. Gotta put one foot in front of the other, no matter what, and just we make it on through.
There you go. Like what it said. Like Monica said, just one of them days, huh?
Just one of them days.
Just don't wear them shoes she
had. Especially after what the old school women say, can't wear white after Labor Day.
Yeah.
But how you doing today, Joe?
Man, everything is good on my end. We're doing our best to take care of our clients and take care of our community. And we're working to get our outreach back into the community and be safe and not contract or spread COVID. So we're working on that. Now, one of the things that we do want that we came here today for this podcast is to talk about STDs, because we're going to talk about STDs, and here we are. And so we would like for you to make sure you go back and listen to our podcast on condoms, on our condom competency podcast, our HIV 101 podcast, as well as our Pep and Prep podcast, because they go hand in hand with this STD podcast. So let me get my screen sharing going on so we can jump on in it, like my name Bennett.
We're going to jump on in it.
There you go.
Make sure you glove up.
Hey, look, the thing that we want to stress is safe sex is important to helping to maintain a high quality of life.
That's right.
I don't care who you are. I don't care who your mama is. I don't care who your daddy is. I don't care how much money you make. I don't care what kind of clothes you wear, what kind of cars you drive, what school you go to, how many degrees you have. You are not the person who will just be immune from an STD. And there are all types of STDs that people can contract. And we don't want people to think, especially our young people, to believe that, hey, it's not going to happen to me. Those are the people that we see in our office all the time, right?
Mm-hmm.
So we want to make sure that we give y'all real good information, practical information that you can use moving forward to help protect yourself from safe sex. And please, please, please go back and listen to our condom podcast so you can learn more about the condoms and be using condoms and the different types of condoms so we can protect ourselves.
That's right. Right. That's right.
So go ahead.
The first thing we really want to do is most people be like, you're always talking about sex, you're always talking about condoms, but we do preach abstinence. So we really want people to understand that our is too is to preach abstinence, that we don't want young people out there having sex before it's their time. We really want people to understand that when you get ready to have sex, that's something that you really want to do, something that you thought about, something that you plan, something that is you're mentally ready and prepared for, because your life is going to change the moment you have sex.
Yeah.
It could change for the better, it could change for the worse. I mean, the possibilities are endless. So what we really want to do is we really do preach abstinence, but we live in a realistic world. Me and Joe are more realistic than most people, and we do have high hopes for people, but we can't control exactly what young people do today.
Right.
And so when abstinence, most people be like, oh, you just don't want me to have fun. You don't want me to do this. You don't want me to do that. No, we're just trying to keep you ready, because a lot of people who are having sex aren't ready to have sex.
Right.
A lot goes into it. It's not just the stuff you see on TV or in music videos or in movies. A lot more goes into it. And people don't understand, when you get ready to have sex with that one person, you're giving them a piece of you.
Right. Right.
And we stress that to the young kids that we teach. We teach classes going from maybe 6th grade on up. And we really just, try to preach them. It's not what it's all cracked up to be. It's not how glorified people make it be. Yes, does it feel good? Yes. Is it enjoyable? To some extent, yes. Depending on what you're doing, your first time might not be as enjoyable as it will be later.
Right. But see, I want people to understand, first of all, having sex doesn't indoctrinate you or put you in some kind of secret club.
Mm-hmm. It doesn't make you an adult. It doesn't make you
You're not cool.
Anything.
You're not cool. You do the same thing lizards out there doing. I got cats in my backyard. You hear the cats. Like, you a sexual being. When a tree drops an acorn on the ground and it gets covered up, the acorn and the ground, the acorn is the male element, the ground is the female element. Guess what? A tree might grow. That's reproduction. So you're not special because you have sex. And also, we want to make sure people have a different idea about sex. Sex shouldn't be something that we're chasing, we're pursuing, as if this is the goal. I have to have sex, because if I don't have sex, I'm not cool. I know we're talking about young people, but we want older people to understand as well. You're not too old to not catch an STD. And you're not too young to just say, well, I'll get over it. No, what if you get something you can't get rid of?
Or what if you get something you don't even know you have till it's too late?
Right. And then
go ahead.
I just want to say sex is a learned behavior. Sex and sexuality are learned behaviors. And having pleasurable sex is another lesson. So these are things that we're going to give y'all down the line, but we want to make sure you focus on STDs today, right? He busy over there. Stop calling him.
But we also want, like I said, we also preach abstinence and things like that. But we really want people to understand it's not always the funs and games. Because once you get some of these STDs, they're sometimes hard to get rid of. Sometimes they're hard to really, treat. Sometimes it makes it difficult for you to do the normal day-to-day operations. So the first question is, how many of y'all know what an STD is? Or, in other words, the new version is STI.
STI.
So what is an STD? An STD is a sexually transmitted disease, or a STI is a sexually transmitted infection.
Right.
So what the difference between those two is, the disease state is where basically it's just a disease state. It's saying that it's a disease. So most sexually acquired infections are diseases, but they come from an infection. And so we really want you to understand that we're treating the infection portion of the STD. So we switch it more from a STD clinically to just say, because it's an infection, and they later turn into different diseases and other complications that can come about. So we really want people to understand, and there are basic STDs, and there are some newfangled STDs that Joe's going to get into later. To always go back to when your mama used to say, be careful where you put stuff because it might fall off in the morning.
we are there.
We done got to them days now.
Yeah.
So
Yes.
some of these regular STDs that people be like, oh, that's just gonorrhea, that's just chlamydia. Some of these STDs will kill you faster and quicker than you getting HIV.
Yeah.
Or some of these stuff now will actually make your penis or your vagina just fall off. And you'd be like, what happened? So
yeah. I mean, like some of the bacterial infections you can treat. So we know chlamydia, gonorrhea, syphilis can be treated. But that doesn't mean you go out all willy-nilly, just, hey, I can treat it, let me get an STD. No, that's not smart, because every time you contract an STI, was the STD, STI, every time you contract one, you're compromising your immune system. You're bringing more harm to your body than you would if you haven't contracted it. So I know a lot of people who are anti-condom. I'm just not going to use condoms. I can't perform using condoms. That's a mental thing. If you're like, I can't perform with condoms, you might need to see somebody about that, because you're opening yourself up for all types of risk and all types of diseases. And I like the second question, because it's asking, how do people contract an STD, right? And so most people, when they're like, well, duh, sex. Well, what about just casual contact?
Because you know what, Joe, when I was looking earlier, I was looking at what's the real difference between an STD and an STI. And the only difference is basically it's a disease and an infection. Yeah. But all diseases don't begin with infections.
Right.
So they really kind of had to change it to STI, because most STDs start with an infection, and not all diseases start with an infection. So, you know what I'm saying, breaking it down that way. So, like, most people don't understand, you can get stuff from touching things.
Right.
And that's hard.
So Mathias and I were out in the community about 2 years ago doing testing on our mobile unit. And it was 2 separate occasions. We had 2 couples. And in each couple, both persons in both couples were at the second stage of syphilis. So and I'm gonna we'll show you when we get to that part of the slide, what we call palmar plantar, where they have the syphilis rashes on the palm of their hand and the plantar or the bottom of their feet. So it would, if we wouldn't have had our gloves on, and if we would have shook those young men's hand, syphilis would have been transmitted from them to us just through casual contact. Some STDs can be passed just by touching. So that's why I like this question, because I want us to take our minds outside of just sex. Also, even if you put a condom on, and I'll show you one of the slides in here where I get more specific with it. Even if you put a condom on, that doesn't necessarily guarantee that you're going to be 100% protected from the STD, depending on the area that the STD is.
You're right. And then, like, most people think that the normal ways of people having sex is the only way for people to really get affected by STD. You know what I'm saying? Most people think it's just penis to vagina, oral sex, whether it's mouth to vagina, mouth to anus. Then you have anal sex, where you have the different penetrations to the rectum, as well as the oral sex. And then you have digital fondling. A lot of people don't understand, you can get things with these 5 fingers here.
Yeah, digital
with your 5 finger. It's very bad.
Remember, your fingers are your digits, your fingers and your toes.
And we have seen toes going inside vaginas and rectums. The possibilities are endless on what people do nowadays. That's another reason why we always tell the kids, and even adults, ask people what they like sexually. When you're getting ready to have sex, these are the conversations you need to have. What do you like doing? What are you into? What are the things that you will and won't do? So therefore, when you're in the act of having sex and somebody all of a sudden starts peeing on you, you need to make sure that you understand that you need to have those conversations, because it's a lot of different ways out here for people that spice up their sex life and do different things that turn people on. So you got to be very particular when you're having sex. It's not just no more, we meet up, we have sex, penis to vagina, penis to anus, all that stuff. We don't, it's not that. And like, you got to look at when you're having vaginal and penile sex, that's the normal way. That's basic. People aren't basic anymore.
Well, see, even in that, if people really study the history of sex, what is normal?
There
Because
is no
you got to
normal,
remember
really.
the Kama Sutra, which the Kama Sutra translates to love lessons. So it's
Mhm.
lessons about sex. Kama Sutra go back over 3,000 years. We talking about multiple and multiple and multiple sexual positions from the Indian culture.
Mm-hmm.
So there are social and cultural norms that people will adhere to that they came up under. But when you're introduced to new things, or that could expand the idea or normalcy. So normal is relative. So you can't tell somebody, well, that ain't right. Well, it's not. It may not be your norm, but that doesn't mean it's not anybody else's norm.
And that goes back to what we learned through the Compass Initiative. It's the new now. It's not the norm. It's the new now. And as the age and as we grow older and as the times change with the millennials and everything else, that's just like, Joe, when we were younger, we didn't have apps we could look up to and say, hey, we can
Right.
get a hookup from.
Right.
We barely had that. What was that? AOL Messenger and Yahoo Messenger. You got
Yeah.
message.
Yeah.
So I mean, the times have changed. Now things are at people's fingertips. It's more of a generational thing. And each generation, the new normal is going to change every day.
Right. And I would encourage parents and adults to be more active and attentive to your children on their phones and the different things that they're doing online. Snoop, you paying for it. Get up in their stuff. You
Mm-hmm.
paying for it. You
And
like find out what's going on. If it's something on that phone that you have no idea, then they probably shouldn't be using it because you don't know about it.
I mean, ask questions. And that's what we also go back to as well. Just, not trying to jump all over the place, but parents need to be able to have that open line of communication with their children. That's what we're finding a lot of issues is when we ask young kids, how many people have been introduced to sex by their parents? Nobody really raised their hand, but maybe one or two. But you got to look at this. Where are these people getting their sexual knowledge from? Where are they getting their education from? If they're not getting it from me and Joe sitting in a classroom or another healthcare professional at church or at the rec centers or the different community centers here in the city or going to their primary care doctor's offices, because a lot of primary care offices don't talk to children about safe sex practices.
Right. Well, see, one of the problems with that, and then after this, we're going to get into it, but a lot of people think that they are knowledgeable about sex because they have it. And I just try to put it in a way that people understand, like there are a lot of things, like you drive a car every day. A lot of people drive a car every day and have no idea how an internal combustion engine works.
Mm-hmm.
So just because you have sex doesn't mean you understand all the mechanics and things about sex and sexuality that can make sex safe and pleasurable. And so these are things that people need to be concentrating on. But let's jump into this thing, right?
Okay.
So the first STD, we're starting off with bacterial infections, then we're moving to viral infections. So the first one is gonorrhea, right? And it's funny because now when I first saw the slide, I was like, oh, that's the claps. So when you hear older people talking about they had the claps back in the days, or now in the early 2000s, a lot of people were calling it the drip. I know the rapper Eminem made a song about having the drip. I know, drip has a whole nother meaning today. I still won't use it for that, but so it's sometimes called the clap, drip, dose, strain, gleats, or the whites. Bacteria infection. So the incubation period, the time that it can take to grow in your body or develop in your body can be between 1 and 30 days. The average is 2 to 5 days, and that's real. That's real. A lot of people will have symptoms within 2 to 5 days, but some people can be asymptomatic. So these are some of the side effects that you could get from gonorrhea if it's going untreated. We're not saying that as soon as you contract gonorrhea, this is going to happen. We're talking about if it's been in your body for a while, it's going untreated. So you can have heart disease. Sterility is not being able to produce. You're sterile. You're sterilized. You can go blind. You can have arthritis issues, kidney damage, meningitis, and strictures of the urethra. And usually that would lead to the irritation of the burning and things when the person urinates after they have it. So this is a picture of gonorrhea discharge in the penis.
Mm-hmm.
And so when we calling it the drips, when people call it the drips, that's why they call it the drip, because that discharge, that's the body trying to fight off the infection within it. And penises, healthy penises, do not discharge. You ever just walked around discharging? So healthy penises don't discharge. Now, vaginas do discharge on a regular basis, but there's a difference between healthy discharge and unhealthy discharge. So I don't want people to see this and think, whether you male or female, well, especially if you're female, that because you have discharge coming out the vagina, that something is wrong. That's not necessarily true. The vagina is a self-cleaning instrument, so discharge can happen. But the penis, not supposed to discharge like that.
And we want you to think of it as, you know how, this is a good picture right here. You see how it has that yellowish color discharge coming out? Think about if you get a cut and your cut kind of scabs over and gets that yellowish discharge thing on. That's your white blood cells in there fighting, trying to clean out the infection. But the body's not able to fight this off by itself. It needs a type of antibiotic that you need to have in order for you to cure up this infection. So the body is letting you know something is wrong. It's not a lot of people can mistake this now, girls or men, when you're out there finna have sex, you might think, oh, he's pre-cumming, something's, you got to understand the difference between a discharge and pre-cum and things like that. You know what I'm saying? Most pre-cum is clear. It's just, you know what I'm saying? It's just there. It's a little sticky little stuff, but you got to understand the difference in when you're going down, especially when you're going to have fellatio or oral sex. You need to make sure that you know what you're looking at, because you put this in your mouth, you touch it, you own it. That's one thing that me and Joe, you're going to hear a lot from me and Joe today, is you touch it, you own it. Look, once you put that in your mouth, it gets into your mouth and everything else.
You can get I want to make this clear for people. There's no part of your body that's exempt from STDs. You can get STDs from the top of your head to the bottom of your feet, inside, outside, front, back, diagonal, whichever angle or whatever you think, you can get an STD. Because your body is a biological compound, and the STDs, especially bacteria, it's another biological compound that's trying to stay alive.
You're right.
And your body helps it.
And so also the one key thing is that I'm jumping everywhere, but
it's all good.
The one thing that I want you to understand as a healthcare provider for myself is when you go to the doctor, I need you to tell me what type of sex you're having. Yes. I need you to be open and honest with your healthcare provider, because I can't help you if you don't help me. So if you're telling me that you're just having regular vaginal sex and you also all of a sudden have a discharge out the rectum, my questions are going through is like, okay, you're having anal sex, but you need to tell me you're having anal sex so we can check these. When you come to the clinic that at Neighborhood Medical Center, we do an extensive treatment on you, or as far as examination. So we might swab your mouth, we might swab your penis or vagina, and we might swab your rectum, just because you're not going to tell us exactly what type of sex you're having. So if we do swab your rectum, and a lot of times we do swab it, we find out that the person has gonorrhea and chlamydia in the mouth and the rectum, but not the penis. So you haven't been using your penis, but it's in your mouth and your rectum. So think about it. If you're only giving head, or look just in the eye, you can actually see what happened, and you can use your imagination on how this person got gonorrhea in the eye.
Well, now, we did have a case here in Tallahassee about 6-7 years ago, where a young girl, she ended up having sex with an older guy, teenagers, but having sex with an older guy. He gave her gonorrhea. She had the bacteria infection, but she may not have cleaned herself properly. Once again, use your imagination, but her and her mother shared eyelashes. You know, I'm not an eyelash expert. I've been wearing my regular eyelashes all my life, so I don't know about the eyelash exchange. But when her mother put the eyelashes on, that helped to transmit the bacteria to her mother. So she transmitted gonorrhea to her mother via the eye, and everybody else in the household who she came in contact with got gonorrhea. Mm-hmm. So it can be easily transmitted, and it can be it could be in your system, whether it's symptomatic or asymptomatic, meaning having no symptoms or signs. And look, we get calls all the time, especially about people having gonorrhea or syphilis, or especially in Tallahassee, our number one STD is chlamydia, having it in the back of the throats. So we see this. This is one of the classic signs of gonorrhea or chlamydia. But this isn't. This is something that's new to people. So we have glands that sit behind our testicles called the epididymis. And the epididymis helps to house and produce sperm. And if the epididymis is compromised because of gonorrhea or chlamydia, then it will cause the testicles to become swollen and tender. And we're talking about something that's painful, that hurts, and you probably won't be able to walk around or do anything for about a week or two because of the pain that the STD has caused, or the discomfort that the gonorrhea or the chlamydia has caused for the epididymis. And remember, we're talking about sterility, being sterile, not being able to produce in the future. If any of these STDs, STIs, whatever you call them, if you get them, go get treatment immediately, especially if you're trying to have a healthy life moving forward.
And also, if you look at you have the penis here, right? This does the same exact thing inside the vagina. It's just called pelvic inflammatory disease. We have some images of it up in the chlamydia section, but we want you to understand that gonorrhea and chlamydia are kind of hand in hand. They brother and sister. They look almost alike, but they might have the same signs and symptoms, but they're not the same. So the treatments are different, but the signs present as almost the same thing. So in a female, it just will swell up the ovaries and cause sterility, as well as it could cause a lot more other problems where you have pelvic inflammatory disease, where you can actually have to have half of your uterus removed and your fallopian tubes and all that. And that way you might not be able to actually produce a child later, or you would only have one working side of your ovaries, where it makes it harder for you to get pregnant later on from just a small, not a mistake, but a small incident that happened when you happen to be maybe careless, or somebody wasn't really being honest and open with you about what this is, or you not going to the doctor getting checkups like you're supposed to.
Right. So please, please, please go get checked out. I know a lot of people be embarrassed to go get checked out or go get treated. You don't have to. It's not like you have to go tell the world that you're going to get treated. Just go get treatment. And nobody actually knows what you're in these clinics for, unless you go in and just tell everybody. So now this picture is called disseminated gonococcal infection. And basically what that means is the gonorrhea has been in the person's bloodstream for a while, in the system for a while, and it's moving through the bloodstream. So it's showing up in areas where stuff, in the joint areas where stuff bend, move, twist, and turn. So going back to talking about arthritis problems with this, these lesions, if open, could definitely transmit gonorrhea. So it doesn't have, this picture is, as far as looking at it, the aesthetics, it's the least intimidating picture on this whole slideshow, but the potential of transmission is just as high as any other.
Right. And then also, Joe, go back to that slide real quick. Now, this is where digital fondling comes into play.
Yeah.
So just imagine if your partner has an open sore like this on his finger, and you don't really notice it. You think it's just a spot, but you can actually insert that into the vagina or the rectum or into your mouth, and you can actually contract gonorrhea.
Yep.
So we just want people to understand how all these different organisms all play into one part. The finger, you would never think about somebody inserting a finger inside you could cause you to get an STD. You're thinking you're being safe, but you might not be being safe. And also, if you look at his fingers around the nail beds, you know how you have them nail biters? If you're a nail biter, 9 times out of 10, most of your skin is open. So you have open cuts and sores or little wounds on your finger, and you insert that into the vagina or the rectum. That's another way for you to get into it. It's just looking for any opening it can get into your bloodstream. So you got to be very careful about what you're doing and the type of sex that you're having.
Right. Look at you dropping that knowledge on me.
I know, you know.
So this is a picture of the gonorrhea inside of the vagina. And how I look at it like this, because a lot of these pictures, a lot of these things, I think about myself as a as a 15, 16, 17, 18, as a teenager wanting sex. And nobody taught us about sex. Nobody taught us anything. So we just knew what we thought we knew. All we knew is HIV existed and you use condoms. I was in 6th grade. They gave us a safe sex video to watch. And the only thing I remember from the video is a little dude like, I ain't gonna get nobody pregnant. I use condoms.
Mm-hmm.
But they never taught us how to use condoms.
Mm-hmm.
Go figure, right? So you're not going to be able to open up the vagina and see what's going on the inside. So you're either getting tested to know your status using condoms after you get tested to know your status, or you just trusting that person to have unprotected sex. And it's funny that a lot of people will get mad at somebody because they contract an STD, but not taking into account their role and their responsibility in the act. Like, who made you have, if nobody forced you to have unprotected sex, if nobody coerced you into having unprotected sex, you got to take that responsibility on your end. So, and at the bottom, see this last bullet point, most are asymptomatic. So inside the vagina, it could be asymptomatic. You might think everything is going good, but it's asymptomatic. You don't know. So, and the second bullet point, it could lead to pain during sex. So, now this is what we're talking about the abnormal vaginal discharge. Now, I'm not going to sit and act like I'm a vaginal discharge expert, because I'm not. But all I would tell people at this point, male or female, if it don't look right, smell right, sound right, don't do it. If you have to think twice about doing it, don't do it. Don't do it. I'd rather you have somebody mad at you and talking junk about you because you didn't do the sexual act, rather than you doing the sexual act and contracting something that you may or may not be able to get rid of.
Mm-hmm. But Joe, when you see that picture,
yes,
what do you think of?
Honestly, me?
Because you thinking, you 16, you 15, 16,
or
maybe
just,
even 14.
Or just uneducated. Well, if I was raised by porn, I'm thinking she read it.
Mm-hmm.
That's what I'm thinking. If I'm raised by porn, if most of the information that's given to me has been inaccurate information, I'm thinking, well, that's vaginal lubrication, that's vaginal fluids. She read it for me.
Mm-hmm. So she done cream, she read it. She
right.
You done got it turned on.
Right.
But you know what I'm saying, Joe, what's your favorite quote that you always say when you see this, when red means?
Red means, and when we're talking about sex, if the color red wasn't introduced, especially talking about the mucosal lining, so that's the inside of the vagina, inside the anus, inside the penis, back of the throat. Hell, you can even flip the eyelids. Remember when you were young, people used to flip the eyelids in and out, and it was bright pink. So imagine somebody flipping that eyelid in and out, and it's bright red.
Something wrong.
That means infection. So that's what I mean when I say red means stop. And we'll give you a better example as we move forward.
Mm-hmm.
So you see, well, here we go. Red means stop. So she has gonorrhea in the back of her throat, or this person has gonorrhea in the back of their throat from oral sex. So going back to the movie Booty Call, growing up, we had no idea why they was wrapping themselves up in Glad wrap, but They were teaching us something that should have been reinforced by the adults around us. But I am glad that information was put out there, because they were putting safe sex out in the atmosphere. But going back to our last for the podcast about condoms, we showed you about dental dams and how to use them. That will prevent this.
Mm-hmm.
So there you go. What you was explaining earlier about the pelvic inflammatory disease. So you want to elaborate on it?
Just making sure that you see on one side is a healthy, normal ovary system, the fallopian tubes, and the uterus. The other side looks like kind of like the spider web thing. That's the infected side, where it's swollen, it's causing problems. And what's it doing is it can actually be eating up your eggs. So it could actually make you sterile. So yes, on one side, but it could transfer to the other side. This is also very painful. And you could just fall over and don't know what's going on, like you have abdominal pains and cramps. That's why it's very important for you to get checked out when you get these STDs. These STDs can honestly almost kill you faster than a regular disease like HIV and other things like that. because it's bacteria. Once it gets into your bloodstream, it gets into your organs, it can cause vital damage if it's not treated. And we want people to understand you got to make sure that you go to the doctor, get the test, get treated. Ladies, when you get this pap smear, ask for an STD test. Don't just automatically assume that it's going to be included in your results. You get the pap and you say, oh, I'm good. They said everything came back negative. But they're only looking for cells for cancer and other things like that. They're not looking for your regular STDs and HIV. So when you get your PAPs, we want you to ask your provider, say, hey, can I get a full STD panel while you're down there in the PAP? It's the same thing. They're going to use the same brush, swipe and collect what they need to collect. So it's very important that you make sure, because ladies, this could be a big problem later on when you get to those childbearing years and you're ready to have children.
Right. Hey, we need to just to know, we need to make sure we do a podcast on making the most of your healthcare visit for our viewers.
Okay, I'll write that down because that would be a real good one.
Right, and have one of our providers come help with that. So this is another example of disseminated gonococcal infection. So this, what you see here with the lesions on the fingers, same as on the ankle. Once again, the ankle is a joint place where stuff been moved, twist, and turn. So gonorrhea can show up in these different places. All right. So now we move to chlamydia. Chlamydia, like Mathias said, chlamydia and gonorrhea, brothers and sisters. Difference would be incubation period, and some presentation, but mostly incubation period. So this doesn't have as many pictures of chlamydia because we pretty much showed it with gonorrhea. But looking at the presentation, symptoms in females, abnormal vaginal discharge, we talked about that. Pain during sex. If not treated, you can get PID or the mucopolent cervictus. Basically, it'll compromise your cervical area, compromise your whole birth canal, and could lead to sterility if it's not treated. Symptoms in males, discharge from the penis and burning when you urinate. So usually those are classic signs you need to get into the clinic ASAP. And so complications, if not treated, you get the epididymitis, you get the swollen testicles and things with the epididymitis, the epididymis being compromised, or non-gonococcal urethritis, basically when you're burning when you urinate. So, all right, so this is a picture of a baby who most likely stillborn because the mother had chlamydia during the birth and wasn't treated, and the child unfortunately contracted chlamydia
going through the vaginal canal.
Right. So if you are giving birth, if you've had a history of STDs, your doctor needs to know. Yeah, please, people, please be communicating honestly and effectively with your doctors and your providers. Don't just be out there lying, because you could compromise yourself and others. So, like I say, testing and treatment for gonorrhea and chlamydia, easily detected by lab test, easily cured by antibiotics, but any damage done to your body would not be repaired. So what that means, if the disease prolongs and persists in your body and causes damage, it's something that you're going to have to go the extra mile to get fixed, to get healed or something. It's just not going to just clear up like that, like the disease is. So, all right. So that's gonorrhea. That's the chlamydia. Let's get to the syphilis, right?
Oh, Joe, go back. Oh, well, you have to go back. But we also want you to know that sometimes gonorrhea and chlamydia are asymptomatic. So I want you to understand, sometimes they don't show signs and symptoms at all. So the only way you're knowing that you have these STDs are getting tested. So please make sure that you do get tested. We regularly say you get tested. If you're having regular sex, you're having more than one sex partner and things like that, we really suggest that you get an STD panel about every 3 to 6 months?
Every 3 to 6 months, and every time you get a new sex partner, you need to be getting tested. And using safe sex practices. Because getting tested doesn't keep you safe from contracting STDs. And I want people to say that. I want people to understand that, and I'm going to say it again. Getting tested is not your prevention from getting STDs. Getting tested, all that does is tell you whether you have an STD or not. That's not prevention.
That's right. And also, most way, we just going to put you on game, ladies. Most way men get tested is through you. So when you go get tested, you're saying, oh, I'm good, I'm okay. So guess what he's thinking? I'm good, I'm okay. But
Right.
guess what? You're not the only one he's sleeping with. So you might be good at this time, but next time it could be a different story or something hasn't just came up. We want you to understand that if you had sex the day before you went to get an STD test, your results might not show up if they're positive or not.
We had a gentleman call a couple of weeks ago who was irritated because the young lady he's messing with or talking to demanded that he getting a STD test before they had sex. Whoever that young lady is, if I ever find her in my life, I have no idea who he is or her is, but if I ever find her in my life, I'm buying her some lunch or dinner because that's how you're supposed to do it. And if he got a problem with it, if anybody got a problem with getting tested, tell him to kick rocks. Because guess what? You don't deserve this anyway.
Right. And if a person doesn't want to get tested, they might be trying to hide something from you.
I think
or
you might
just
give me something.
You know, so you never know because people are not honest. And that's why it's important to ask these questions. Don't be afraid to ask, have you had any STDs before? When's the last time you got tested? This goes back to, you know, as the old folks say, you got to go coat the people. You got to get to know the people you're having sex with.
Yeah.
Because like you could contract something like syphilis. Now, me and Joe see syphilis almost on a daily basis.
All the time. Oh, too much.
Too much, and it shouldn't be actually coming back. Like right now, there's kind of like a little small epidemic with syphilis that's going on. So syphilis was known as, what was it known as, Joe? The zipper, bad blood,
zipper cut. I never understood that. People, like, if you look at the syphilis, how it looks, I never got my zipper caught. I don't know what that scar looked like, but I just imagine that wouldn't look like a syphilis.
I don't know either what the zipper cut really, because it's not even a zipper look shape. It's like more like a oval, like ringworm type shape.
So I'm not. How do you? That's why I am. How do you convince somebody? Yeah, man, I just caught myself in my zipper, and it's circular.
So I don't know what kind of zipper they use. In mine, the one I use, kind of rectangular-ish. But you know what I'm saying. So syphilis is caused by bacteria. So basically, its incubation period is 10 to 90 days. Average is about 21 days. So basically, whenever you get syphilis, you will have some type of lesion, is what I want to call it. It's a lesion that is painless. So it might be on your tongue. It could be on the roof of your mouth. It could be on your penis. It could be on your vagina. It could be on your rectum, or it could be on the area where the actual lesion or the fluids have touched. Again, this is another highly contagious one. If you touch it, you own it. As you look at the picture right here, is a primary canker sore, or the lesion that most people get with syphilis. Now, if you look at the penis, it's an uncut penis. So just imagine if you're getting ready to give fellatio, or he's getting ready to insert it into you, and you don't pull back the skin to look, and you see how it's open and oozing out stuff. Once that touches your body and it gets inside of you, you touched it, you own it, because that's the bacteria coming out, expressing itself from the body. So if you would have never pulled that skin back, or you didn't look at anything, or, you know what I'm saying, me and Joe say, stop having sex without the lights on, turn the lights on. You show me you, I show you me. We going back to that old school way, show and tell. Because if you don't, you plop this in your mouth or into your vagina, or your rectum, you contract the syphilis. Things could be different.
So go to the this is a painless sore that could last up to 5 weeks. And so that's the trick to it. It's painless, and in 5 weeks it'll go away. So a lot of people would think, well, I don't have syphilis anymore. Look, if you haven't treated the bacterial infection, you will still have the syphilis in your body. And even if you cure syphilis, it leaves a trace of itself in your body. So we've had plenty of people who let's say they contracted syphilis 10 years ago, and we've tested them and it showed reactive for our rapid syphilis test. So we make sure they get a full blood draw, and it comes back negative. And then, oh yeah, they reveal to us that they've had a history of syphilis. So it's going to leave a trace of itself within you, but that doesn't necessarily mean you have syphilis. But we want people to understand how it works. It's a painless sore that could go away within 5 weeks, but that doesn't mean syphilis is gone. So I'm gonna give you a cliffhanger right there so we can take it So we can still look at these and then move forward. Now, going back to what we were saying earlier about just because you have a condom doesn't mean that everything is safe. So look at the location. Look at the location of the actual syphilis canker sore. Now, this isn't the most aesthetically pleasing picture. So I'm sure a lot of people will find all types of stuff to kind of point at and say, no, well, cool, whatever keeps you safe. But what I want people to understand and zero in it is the location of the syphilis canker sore. So looking at the location, I could put a condom on, insert myself inside this young lady, have sex, and still contract syphilis with the condom on because of the location of the syphilis canker sore.
Mm-hmm.
Turn them lights on, look, explore. And if you don't do that, you're setting yourself up. You have to take your sexual health into your hands. It's your responsibility to keep yourself safe.
That's right.
So look at this one. This is multiple primary canker sores. The person still has the foreskin on the penis, but they have two sores, one here and one here. So imagine you got the lights off and you put that in your mouth, or you put that in your anus, or you want to get fancy like they do on the porn sites and rub it all on your face.
Mm-hmm.
Well, you've opened yourself up to some new stuff.
Yeah. And so it's important that you look at the body parts before you actually touch them and explore, because it's a lot of things that you commit. It could be smaller than that and you don't even see it. And you might not even feel it. So you'll be like, oh, okay, because you're in the moment. You could be, intoxicated. You can be under the influence of different things. And your emotions are taking you on a different roller coaster when you're into that sexual act. So just really make sure you take the time to really look at it and educate yourself and see what things are. Don't be afraid to ask and say, hey, what is that?
Right. So look, if it don't look right, feel right, smell right, if something in your mind ain't right, don't do it. If you gotta think twice, don't do it. Once again, look at the location of the syphilis canker sore. You can put a condom on, go inside the vagina, still contract syphilis because of the location.
And also, fellas and ladies, if you going down on her and going to actually eat her out, you can get this on your face. We want you to understand it's not just penile and genital areas. It is any body parts. We want you to understand. You go down there and put that in your face. It could be on your face. It could be on your mouth, your chin, your cheek. Like, we want you to understand, these are things that can be spread to any body part. It's skin to skin contact.
And there's some people who have canker sores in their mouth who think it may be like some other type of oral sore, dental type sore, but it's actual canker sore because they've had oral sex with somebody who actually had syphilis. So talking about it being in your face or in your mouth, this gentleman right here has the syphilis canker sore in right on under his lip. So imagine being, you're a regular person, you out in public or whatever, and you're forced to walk around with the syphilis canker sore in your face. That would compromise a lot of things in a lot of people's lives. So we have to really be thinking about that. Like I said earlier, no part of your body is safe from any of these STDs or STIs. No part of your body is safe. You have to take your health seriously. So you see this guy with it on his lip.
Mm-hmm.
This guy right here in the middle of his tongue.
Now, Joe, could you imagine walking around campus with that on your face back when we was in school?
No, I couldn't, because we were mean. Look, I used to tell people all the time, and I say this because I want people to think about the social aspects of things as well, and not to just really care, but you don't want to set yourself up for some kind of ridicule because you're trying to live off some other rules that don't exist. But when I was in school, they would call it, what is that on your face?
Mm-hmm.
So people can be cruel, people can be rude. So rude, just thinking about all those things. But even this guy, like this can be concealed more. But I going to the club, and all I is going to the club, is always that one or two older dudes or nasty dudes in the club who just advertising, hey, I lick everybody in here.
Mm-hmm.
And it's like, Well, you might not want to do that there, but what if it's this guy? Because we were, like just this past weekend, we were having a conversation about oral sex, and most people are like, "Hey, if you want to do it, I'm gonna let you do it."
Mm-hmm.
But sometimes you got to be like, you know, I can't let you do it. I don't know you like that.
Right. Because everybody that looks pretty and looks like they, you know what I'm saying, they everything does not mean that they don't got some STD just because they look a certain way. Or the person looks dirty does not mean that they have the STD. But like Joe said, just imagine going to the club and this person come up behind you and just lick you on your neck.
I've seen that before.
You can contract syphilis even though you weren't even doing anything. That bacteria, and you wipe it with your hand and don't do something and then touch your face. Like, just imagine the things you can do, because this stuff is made with bacteria and viruses.
Yep.
What people understand, you have to really be careful about what goes on and what you're doing. Or these people that just get drunk and just start kissing somebody, your tongue and their tongue and touching, you can you can contract stuff. This is what happens on a normal day-to-day basis on the college campus. Like going to the club, becoming an adult or a semi-adult, and you're out here doing adult things, but you're not taking care of the responsibilities.
I've literally seen that with my own two eyes on multiple occasions. So, so I don't know why, but this is the one syphilis picture that gets everybody, that nobody likes. They're like, always like, and I can get it sometimes. First time I saw it had me looking at my fingers for about a week. But it's just funny how this one picture is the one that really opens people's eyes. But once again, look at, he put his finger in the wrong place. And you know, I'm very hygienic. Like I would have just the fingernails. Just the fingernails alone should deter anybody from letting this person touch them. You got too much dirt up under your nails. Like hygiene is an important part of safe sex. Very important part. So just look at that. But this is the first stage of syphilis. We tell people sometimes this is the easy part. So you got this canker sore. It's painless. It goes away in 5 weeks, right? So now we get to the second stage, which is the body rash, the syphilis rash. And it can cause skin rashes, fever, swollen lymph glands, headache, hair loss, and muscle ache. Skin rash may be on the palm of the hand, the bottom of the feet, or any part of the body. Going back earlier when we talked about palmar plantar, the rash could last from 2 to 6 weeks, an average of 4 weeks, and could heal. Even at this stage, the rashes could go away without treatment. But guess what? You can still pass it on. So going back, looking at this picture, once again, let's start with hygiene. What's that between your teeth?
I don't know.
That's what my mind would be. That's where my mind would be with this person. And now, what's tricky about this particular one, this skin rash, is for the untrained eye, it looks like acne. And most people have untrained eyes when it comes to infections, to bacterial and viral infections. Most people have untrained eyes. So this is like a bad case of acne, but it's not. It's the second stage of syphilis. So.
Right.
But look at this. It's not pretty.
It's not pretty. And when you look at it, if you see like some of those sores, they're open, so that it could be spread. So just imagine just patting people on the back or touching people. You could actually get this stuff on your hands. It could be seeping into clothes. That's another reason why we always tell young children, do not share eyelashes, lip gloss,
underclothes,
eye makeup, like the little mascara stuff you put on there, any type of makeup brushes. Don't share underwear, bathing suits, those type of things. Because girls be like, oh, it's cute. Oh, look, try it on. You try it on. Be careful when you go into the stores and try on things. They might not have that little panty liner thing in there that they're supposed to have in there. Make sure you be careful on trying stuff. Wash things before you perk them on. So we really want people to understand that this stuff is contagious. It's very easily spread. And once you get like this, like he says, once the things are done to your body, we can't fix all the side effects, because might have scars, things like that we can't reverse, because this is what happens. It might not be them big bumped up scars, but it could be dark spots. Yep. And then you have to deal with people saying, hey, what happened to your back? So just making sure that you understand those are the things that we're talking about.
Yep. This young lady is all over her body. Once again, turn them lights on and look. That way you'll know what's going on with the person that you potentially going to have sex with. So this is the classic picture of what we call palmar plantar. See the sores on the palm of his hands, and then you can see the sores on the palm of his feet. This is what we normally regularly see for somebody who has this second stage of syphilis, right? So, like on average, Mathias, how often would you say you see it?
We see it quite a bit. We actually, a couple of years ago, me and Joe almost contracted syphilis.
Right. So when I was telling you that, this is what it looked like when I was telling y'all that.
And just imagine us taking a pen. This is why it's very important that you never share pens, different things like that. And you always keep hand sanitizer with you. My friends call me hand sanitizer because I'm always got hand sanitizer with me. So, but looking at the hand, imagine if those sores are open and the fluids are there. You might not see them, or if they bend, it could crack open, a little fluid could get on the pen. You share that pen and you have a little opening on your skin or something, you might not see it, those microscopic cuts and things, that bacteria likes to get on there and house into it, and you can contract the STD. So we really want people to understand it's very important, because we almost contracted it twice and it was like, yeah, you keep the pen, it's okay.
Right.
So, I mean, just looking at things and everything that's like, if they got like a little callus or something, does not mean they got syphilis. I want people to understand that.
Yeah.
Syphilis is known as a great imitator.
Yes.
So it can take itself to be other images. It can alter itself to be whatever you think it might be. And that's the issue with STDs and skin rashes, because you never really can pinpoint what the skin rash is. You have to be able to see the blood work and the testing, so we know exactly what it is. So we have to swab the fluids and stuff like that to see what it is, because it could be just something that's happened with an allergic reaction. So just because somebody has spots and things on their hand does not always mean they have syphilis.
Right. So here's another example of the secondary rashes. You see it's going all in this person's nose, all in their mouth, all over the chin. And it's vaguely, but you can see it on the neck. It's going down on the shoulders and things. So all parts of your body, no part of your body is safe from an STD. Don't allow anybody to lie to you. Let's stop taking sexual information from people who are not sex experts. Because we do that a lot. You won't just go to anybody and let them tell you about your car. So let's go to the sex experts to get sexual information, right? But once again, a lot of people think they know because they do it. That's not necessarily true. So talking about syphilis being a great imitator. So this is syphilis. This is the vaginal area going down to the anal area. And this syphilis looks just like genital warts. So this will be very painful, open sores that are busting, sores that just compromise everything with this person. Got to be careful, because this is not what you want. So Mathias, with this, how would this tell people how syphilis is treated?
Syphilis is treated with a injection called bacillin. And bacillin is a very painful injection. It's a thick toothpaste-like type material, I would say, like a substance. It's really thick. It would keep it in the refrigerator, and it's normally in a shot, and you get about 2.4 million units of bacillin. So sometimes they come in 1.2, so you get one each hip. And just depending on the protocol and the stages that you're in, it could be from one shot to where you might have to even come back and get a series of shots, depending on how bad the virus is within the body. So, and like I say, like this looks like other STDs, as you're going to see later on in some of the pictures don't get better, they get worse.
Right, they get.
So you're through the easy part of the presentation, but the pictures do get worse. But just imagine trying to have to go to the bathroom constantly. And because this is actually right between the vagina and the rectum in that little taint area. So you really have to look at that with the acidicness of the urine and things like that. And then you're trying to wash. Now, especially if you have symptoms like this or things like that, and you're doing a bath on yourself and you're bathing, we want you to make sure that you take your washcloth and use it appropriately. Don't wash yourself in this area and use that rag and wash the rest of your body. You're
Right.
going to spread it. And it's sad to say that we have to tell people that if you use bar soap, don't put the bar soap on your body because the bacteria is going to be on the bar soap. Then a lot of people in some households share soap and share things. Be careful on what you share with STDs when you come in contact with an STD, because you don't want this stuff to pop up anywhere else. And
Right.
so, like as you can see on the can they see my pointer, Joe?
Nah.
Over here, over on the bumps, you have like the actual lesion, like the fluid, like it's open. It's not nothing covering it.
Right.
So
Right here.
once you put all that and like over there, those are the things that is going to spread the actual bacteria to you. So once it gets on that surface, and you might think it's dried up, but guess what? You're going to reactivate those things every time you use that thing and spread it. So we really want you to make sure that you don't spread. Keep it dry as moist as you can. I mean, dry and less moist as you can. So therefore, you have the less likely chance of passing it on. But the medication works really well. It's a painful injection. A lot of people, I mean, they don't like the injection, or they can give you an antibiotic, which is harsh on your stomach, which could cause some stomach upset, some GI stuff that make you go to the bathroom and things like that. But I mean, it's just part of the process you have to go through to treat it. But we really want people to understand that we can treat it, but we want you to understand this is one of the most deadliest ones of the diseases, because we have had people really die from this. Like if you
Yeah.
think about William Shakespeare, Al
Yeah.
Capone,
Yeah.
the Tuskegee Airmen, when you look at that,
Experiment. Yeah.
yeah, the Tuskegee Experiment. Go, but if you have not seen the Tuskegee Experiment, I suggest
Look it up.
that $5 bin in Walmart, or you can look at it on Netflix. Just make sure you really look at those type of movies, because they're telling you about what they used to do
Right.
and how it affects your body. Because believe it or not, the way we learn about diseases is from it happening to people and following their stages. It sounds like it's kind of harsh and cruel, like you're wanting people. We don't want people to get it, but once you
But
get it,
that's
we
what it
kind of
is.
follow and track you so we can figure out what else we can do to help prevent other people from going through the same thing you have.
Syphilis, if left untreated, can be fatal, and it can turn flesh eating.
Mm-hmm.
So get to our last stage. So even in this second stage, even though all of this looks bad, syphilis can still the actual bacteria can still be cured at that stage. Now, if
Right.
it's not cured at that stage and it persists to the late stage, which is the third stage, it could cause paralysis, insanity, blindness, damage to knee joints, personality change, impotency. For those who don't know, male wouldn't be able to get an erection, cause an aneurysm, and the tumors on the skin and internal organs. Those are things that syphilis can do at the late stage, but it can also be flesh eating. So I remember watching a documentary about a older man. I think he may have been a part of Tuskegee, but may not. But somehow he ended up contracting syphilis in the top of his head, and it basically ate the flesh of the top of his head. And so he was poor, so he never really got it repaired. So he had to walk around with gauzes and hats and things on. But syphilis can ravage your body. So don't be the person who just like, it's just syphilis. Syphilis can mess you up. Gonorrhea, syphilis, and chlamydia can mess you up if gone untreated.
And we also want you to understand, I like to revert back. What damage is done to your body, we might not be able to reverse. So as you see in this picture, it's flesh eating. So you're going to have that scar from that flesh eating, because when most things are flesh eating, in order for them to get around things, yes, they're going to treat you, but they might have to cut some of that extra skin and that extra meat out to get rid of the actual virus of what's to become flesh eating. So the treatment could get a little bit more extensive, but we want you to understand what is done to your body, we might not be able to reverse. So you're always going to have to walk around with this scar or that skin graft or that big indentation on your hand that's affecting. Now, you also got to look at this hand. Your hand has muscles and tendons and things like that in it. It could affect all those other things that could cause other things. So you could get paralysis there where you can't use your hand and your fingers. So this is what we're really trying to prevent from it getting to this stage. So if you see a little bump or you see a little thing, just ask. Your provider's not going to get mad. It could be a hair bump. It could be something. Ask those questions because you do not want it to get too far when you get to these situations right here.
Let me say this. If you're presenting something to your doctor or your provider and they act like they got a problem with it and they want to get mad, fire them immediately. They work for you.
Mm-hmm.
Fire them immediately and make sure you get what you need to get. And that's why we're going to do our making the most of your healthcare visit, because I don't want people going into these doctors' offices or these providers to see their providers and think that they're at the mercy of the provider. No. That's a relationship. They need you, you need them. Guess what? If nobody go to the doctor and pay no money, doctors got to find something new to do.
And your doctor should be the person that you call and talk to. Start building a relationship with your doctor, because I'm not going here just telling them everything about me. And it's like, I don't even feel comfortable. If you don't feel comfortable with your provider, it's okay to tell them, I don't feel comfortable. I think I'm going to seek somebody else. Now, there's a difference when we say fire your doctor if he doesn't, listen to what you say or something. Now, it's a difference with medical treatment. I want you to understand there's a difference. Now, if you're saying, I want this done,
yeah,
does not mean you fire them because they won't do exactly what you say.
Right, that's different.
Things you got to understand. If you're asking for a certain medication, you might not be able to take that medication. And you got to look at the side effects, what's going on with you, what diseases you have or what health outcomes you have or disparities. So those are the things that we don't want you to think of when we say fire your doctor if they're not listening to you, to understand, because some things are out of the doctor's control. Some things are out of your control. But if you're sitting there telling them, I think I have an STD and I need an STD test, and they don't want to provide it for you, you might want to look for a different doctor. Or if you're saying, hey, I have concerns about this, and they don't address those concerns, then you might want to look for a doctor. But with certain things, like if I say, I only want to be on, I don't know, I'm just going to use the HIV med, for instance. I only want to be on, and this is not non-branded topic, so we're not promoting for anything or anything else like that. I want to be on a tripler or something. But guess what? A triplet's old. I want that, but it's not there. It causes different issues and things like that. So my doctor might say, hey, I want you on something different that's going to help and do what you need it to do. That's not a reason to fire them because they're wanting to change that. They're trying to help you and prevent the side effects and different things like that, because medication has evolved each and every year and is forever changing. So we really want you to understand certain things you need to fire the provider about. But if they're not listening to you and addressing your concerns and things like that, that's what we'll go into more about with the Joe. I think that does need to be our next topic, is making the most of your healthcare visit, because a lot of people don't know the questions to ask or what not to ask, or what do I do with the next step if somebody tells me no.
Right. So yeah, I'm with you. So congenital syphilis, whenever you hear the word congenital usually means passed from the mother to the child. Mm-hmm. So unfortunately, this baby was stillborn, contracted syphilis in the womb. The mother had syphilis. There was no treatment. Looked like may have had a vaginal birth, and couldn't save the baby. So prenatal care is very, 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 very important for men and women. Mm-hmm. Prenatal care is important, especially if you want a healthy child and healthy humans, period.
Where can these people go, or where can anybody go to find out information about prenatal care? Because that is important. Because one thing you don't want to do is pass something on to your baby or somebody that, you know what I'm saying? Because a lot of girls might not know they're pregnant right at first. And then they deny all the stuff and don't know where to go and don't seek prenatal care. We find a lot of people we work with an indigent population, so they don't have insurance. They don't know that you can qualify for insurance, that you can qualify for Medicaid because you're pregnant. So they don't get into the prenatal care, and the baby lacks as well. Not just the mother, but the baby lacks, and that's the issues we're coming up with. So it's very important, because you're not, like Joe said before, you not just affecting yourself, you can affect others and don't even know it.
Yeah. Well, Healthy Start, I know here in Florida, Healthy Start, and wherever you are, look up the Healthy Start program. Go to your local health department. You can even go ask Planned Parenthood. Places like that are good places to start for prenatal care. So you can even go Google prenatal care within your area, within your city. Empower yourself with information, though. Don't just sit back and expect it to come to you. You have to go make it happen for yourself. So we do want to encourage people to do that. So real quick, the testing and treatment for syphilis, similar to gonorrhea and chlamydia, basically the same as gonorrhea and chlamydia. It's easily detected, easily cured, but any damage done to the body won't be repaired. All right, so those are our bacterial infections. So from here on out, we're going to be talking about viral infections until we get to the last two, because we're going to end it off on bacterial. So genital herpes. So there's two types of herpes out there. You got herpes 1, which we all have, and herpes 2, which is the actual genital herpes.
Mm-hmm.
So somewhere long ago, humans contracted a strand of herpes, and it just been passed down generation to generation. Humans have it. So when people get, I got the chicken pox when I was young, so that's a form of herpes simplex, what they call it. Some people get cold sores. Some could present itself as shingles in certain people. So there's herpes simplex 1, which all human beings have. Now, herpes, the genital herpes, or herpes 2 can happen is, let's say I have a cold sore and I perform oral sex on a young lady and I have an open cold sore. My strand of herpes will get inside of her, will come in contact with her, and her body isn't designed to handle my strand of herpes, because mine is designed for me, hers is designed for her. So we have that cross contamination. That's when we get to the herpes 2 point. So that's why we have to be careful about presentations and things that we have going on within our body and within the bodies of the partners that we're dealing with, because that right there could be the difference between somebody just having a cold sore and somebody transmitting herpes to somebody else. So do want people to understand that. So common symptoms, it's red sores that can last up to 2 or 3 weeks, and maybe on the penis, vagina, anus, buttocks, thighs, mouth, finger. It could be all over the place. Symptoms can include, once again, swollen lymph glands. When lymph glands swell up, that's usually an indication that something is really wrong. You get muscle aches, headaches, fever, and difficult urinating. Symptoms may or may not reoccur. On average, symptoms can occur approximately 5 times a year, especially in stressful situations. People who are stressed out a lot have a lot of herpes outbreaks. So this is one presentation of herpes on the man. This is one. So it can look many different ways, but this is one. What I like about this is biracial, is multiracial rather. So you can't say, well, that's just on them. That's everybody. You're a human being. You're alive. You can get it.
Mm-hmm.
So be careful and see how this looks versus how this looks. Different presentations. So red means stop, but pink don't always mean go. So when I look at this slide, once again I take myself back to Joseph as a 15, 16-year-old, and you see the red bumps around the clitoris area. So if you'd have told a younger me, them just hair bumps or something, I probably would have believed it. I most likely would have believed that they're just hair bumps, especially if you're offering me some sex. I'm pretty much believe almost anything you're gonna tell me if you're gonna let me have sex with you as a young male. But now as an older person, I'm like, well, nah, I don't know about that, right? But also, if they opened up the vagina more, you would see that the inside is bright red. As you can see, the anus area is starting to be bright red. And of course, now taking into account the young lady, there's natural pigmentation is there as well. But when infection is present, the mucosal lining of areas usually turn red. Now, there are exceptions. So the picture on the right, This person has the herpes, and you can actually see it on the cervix. You can see the bumps on the cervix, but the vaginal area, the mucosal lining, is not necessarily bright red. So red means stop, but pink don't always mean go. This is an example of herpes on someone's finger. Man, I cut myself trying to fix my lawnmower, something outside, mess around and cut my finger. That's what it looks like.
Mm-hmm.
So looking at that, see this person has the herpes presentation in their face. So it could be anywhere. And as you can see, herpes can be complicated for adults, but when it says lethal to neonates, basically small children can die from herpes complications.
And also, we want you to know that if you revert back to syphilis, how we said they have sores, those are painless. These sores are painful.
Right.
They hurt. They're open, they're oozing, they're sensitive to touch, they're sensitive to urine, especially if you get them in the vaginal or the genital area. They will actually hurt because when you use the bathroom, you're going to be pressing against with the acidicness of your urine, and the bowel is going to actually irritate. So it's very important that you make sure that you understand that these do hurt. You're going to know if you have a syphilis outbreak. You're going to know. And the treatment is simple. It's medication that they can give you. Again, there are a few STDs that you can't get rid of.
This is one.
This is one. And they're normally the 3 H's: HPV, herpes, and HIV. So when you look at those different things, when you have those, they are treatable and manageable, but you will always have them. You will not get rid of them, but you will always have them. You might not have the outbreak and you might not be able to spread it, but you will always test positive for HPV, herpes, and HIV. So we want you to understand those are the 3 that are not curable. They are treatable and maintainable, but we want you to understand that they are not curable.
Right. And see this, you can still spread herpes even if you're taking your medicines.
Mm-hmm.
So safe sex is important. So HPV, human papillomavirus, or genital warts. Some people call them venereal warts. So they're caused by a virus. Incubation period 3 weeks to 9 months. HPV infection is casually associated with cervical cancer and probably other anal, penile, vulval, vaginal cancers. Over 99% of cervical cancers have HPV DNA detected within inside the tumor. So I want people to understand that. So I want to show you the physical presentations of the HPV. See the one on the left? It took the foreskin and got creative.
Mm-hmm. It looks like a little reef.
So it's a lot going on over there. Even though, and the one on the right, that's not as severe or as extreme as the one on the left, but still, it's still the same the same virus within the body.
Mm-hmm.
So you can see the penile warts, different stages, different people on different areas of the penis, but penile warts. So how do people get rid of these? How do people get rid of the warts with these? How are the warts treated?
Well, the warts are treated with, they have to be basically removed. So they'll do like a little cryo thing where they can zap them depending on the size of the wart, or they can put a type of medication on it called TCA, and they'll be able to treat them that way. Or they can actually go and have them surgically removed. But it has to be done by a trained professional. It's nothing that you can just say, let me go to the convenience store and put something down there and say, let me freeze it off or burn it off or cut it off. Needs to be done by pretty much like a dermatologist or a healthcare professional who is trained in using those type of materials, because the medication that they use for it is a strong medication that once it touches regular skin, it could also kill the regular skin. So you could do more damage to yourself versus, you know, saying not exactly knowing what you're doing can cause you a lot more harm than it's going to do you benefits. Right. So definitely seek your provider. Now, when you first get like the 1-2 bumps, I need you to go to not the hospital, your provider immediately. Don't let around and think, oh, this is going to get better. Let me go. Let me not worry about it. Oh, it'll go away. Don't do that, because it's going to get worse. And when it gets worse, it can get worse. We've seen it several times where it's been worse, where it's almost inflamed half the penis. And so you have to really, so that's going to take several treatments, several things, but you really got to be careful because, like I said, it's contagious. Once you touch these things with that bacteria and stuff, you can spread it. You can do those things. So we really want people to understand. Now, when you're young and you're about 10, 11, I think that's when you can get the Gardasil shot. So y'all see the commercial, oh, my parents never told me or this or that. There's a shot out there called Gardasil that helps prevent from HPV. And it prevents you from a few of the HPV, prevents you from about 9 to 15 different HPVs. But if you really look at it, it's several hundred different types of HPV out there that are contracted. The ones that the HPV shot prevents you from is the main ones that cause cancer. So that's penile or vaginal cancer or ovarian cancer and things like that. So it's important to make sure that you do your vaccinations. I know a lot of people are scared of vaccinations and things like that, but I'd rather be the type of person that has some type of immunity to this versus me contracting this, knowing I could have prevented it at some point in time.
Right.
So it's very important that you talk to your healthcare providers about your children's vaccinations. And some of the adults can get certain types of vaccinations and things like that. But just because you have HPV does not mean that you can't get rid of them, but they can come back. Once you do get rid of them, they can come back.
There you go. So this is a presentation of the genital warts on the female, and it disfigured the vagina. And one of my concerns every time I see this, I say the same thing, but the concern is it's covering the urethra, and it looks like it's covering the vaginal opening. So you won't be able to urinate or vaginally discharge. So the body cannot release the toxins out of it. That's what's real, concerning about this particular presentation. So we don't want anybody taking the health light. Like, make sure you're checking yourself out. Like, be cognizant of everything you got going on and everything you're doing. And if you feel like something isn't right, go get treated immediately.
And like Joe said, get treated immediately. When you first start seeing this has been months of this building up. This is that it doesn't pop up like this overnight.
Right.
I want people to understand it does not disfigure a whole penis or a vagina overnight. It pops up over time. And so we really want people to understand the earlier you get to us with certain STDs, the easier the treatment will be. This treatment right here will be an extensive treatment because it's a lot of things going on. You got to look at it's covering the vaginal area, it's covering the labia, it's covering the inner labia, it's covering the clitoris. Do you know how many nerve endings are actually in a clitoris? There's over 8,000 nerve endings in the clitoris. So you got to think about all the different things that you're going through, and you have to surgically remove or surgically, apply certain ointments and things too to help cure and shrink and try to bring back. And then again, once the damage is done to the body, we can't necessarily bring it back. We can't reverse it. So her vagina could be disfigured for the rest of her life. She might lose sensation in the clitoris and other things that are vaginally because it's going to affect everything, because they're going to have to remove a lot of the tissue and natural body stuff that is there for them to try to repair and get rid of this STD.
There you go. So it's very critical that we do things right. So this person, if you can see my cursor, these white areas here where the warts were burnt off or were removed, but you still see the bright redness and see all the scarring of it right here. So this doesn't, remember people, this doesn't have to happen. Like it doesn't have to happen. We need to make sure we get somebody so we can get some real self-esteem talking and stuff too. So
yeah.
What's funny about, I ain't gonna say what's funny about this, but what's interesting about this particular one is usually young people, when they see it, they see the gray hairs and they like, oh man, she's an older lady, she still have sex. And yes, grown-ups have sex, adults have sex. Like, nobody is too old to have sex. And so what we're finding out is we have large populations of people 50, 45 and up who have STDs and HIV. Because guess what? if I've been having sex since I was 15, it's a good chance I still have sex. It's a good chance I still have sex. Somebody turning 50 or 60 doesn't mean they just automatically don't like sex no more unless they have a health problem. But, people are sexual beings. Like, that doesn't just stop. So we want people to understand that, like, be educated on that. Like, there's no like, sex isn't a young person thing. Like, oh, you're only supposed to have sex between 12 and 24. First of all, if you're 12 and you're having sex, why?
Right.
So it's sex. Like, adults have sex. Yes, they do. So this oral warts, you can see the genital wart right here on the tongue. So be careful. Once again, be careful who you touching, who you kissing, and who you allowing to put their mouth on you.
Mm-hmm.
And this is perianal warts. So this person had anal sex and contracted the warts in the anus, and now him eliminating bile out of his system has been compromised. And that's one of the most important toxin eliminations that we have to do.
Between that and the vagina self-cleaning itself with its normal period and things like that, it's the menstruational cycle. So we really want people to understand, like, these things could cause a lot more other problems. If you can't defecate or you can't release these toxins out your body, it could cause a lot of problems because your body can get septic. It can, like I said, it can kill you. You can get the infections in your blood, all this other stuff, and they still got to try to take care of that. It could make you uncomfortable. It could block you up. But just imagine if you have that problem and you have to go to the bathroom. Thinking about this, it's going to be very painful for you to have a bowel movement right now. Then you got to make sure that you clean it properly because you don't want this to get any other infection and breed and do
Right.
anything else, especially with bowel or feces. It has, this could be hepatitis A, C, what I'm saying, all the different things plus other things. And it's acidic. So these things left on your body could break you down even more. So you don't want those other complications to come on with it, the other opportunistic infections.
There you go. And so, if gone untreated, it could destroy the tissues around the genitals and the anus and could lead to cervical cancer in women. So we want people to be informed, understand what they are being informed about, and be able to practically use the information. So you can comment on these podcasts, like, depending on whatever platform you're on, leave a comment, talk to us. If you have questions, matter of fact, if you have questions, you can email me at jward, JWARD at neighborhoodmedicalcenter.org. You can email Mathias at msweet, MSWEET at neighborhoodmedicalcenter.org, and we'll gladly break it down for you even further. And if we can't, we'll find somebody who can.
Mm-hmm.
So we talked about testing and treatment. So now we're down to our final two. And so we're back to bacterial infections, and we're back. These are severe bacterial infections. So this is granuloma inguinale, which is a form of chlamydia. And we learned that over a year ago, because we've been teaching this for a while, but we didn't know that this was a form of chlamydia. But we've learned that, okay, granuloma inguinale is a form of chlamydia. So it's flesh eating as well. So it ate the head of this penis off. I don't really need to explain too much more, but the person contracted it. We still learning more about the incubation periods and stuff, but over time, the head of the penis was eaten off. So yeah, so did the same thing to this vagina. Over time, this vagina was compromised. The labia majora, the labia minora, were eaten off by the bacteria. And remember, these infections are bacteria trying to stay alive.
Mm-hmm.
So this last one is lymphogranuloma venereum, or the LGV, and similar to granuloma inguinale, but with this one, it causes the body parts to expand, blow up, and expand, and then decompose. And that don't sound good, but think about what I'm saying. It causes the body part to expand and decompose. So this penis, it expanded, and then it decomposed slowly from the inside. As you can see, it looks like somebody kind of ran over it, but
Mm-hmm.
it decomposed from the inside. And this last one, this is a woman. This is a vagina. It caused it to expand, to blow up and expand, and then decompose. We're still trying to figure out what this red on the side, we're still trying to really figure out what that is. But all we know is this is a form of chlamydia, a bacterial infection that this person or these people contracted, and it disfigured their bodies to this point. Nobody has to go through this if we take the proper precautions to protect ourselves. Now, with that being said, we also understand that humans are humans, and we reproduce ourselves through unprotected sex. So I never want a person to beat themselves up for having unprotected sex. I never want a person to think that unprotected sex is wrong or bad. That's not true. The presentation or the existence of STDs is the problem that take everything left. So protect yourself. It's your job to protect yourself, educate yourself. Use condoms. If you're a woman, have your own condoms. If you're a man, have your own condoms. Learn how to use them properly. Go back and look at our podcast on condoms. It's up to us to make sure we take care of ourselves and do things properly. And if we don't, we're opening the door for worse things to happen to us, and we're not taking our health serious. Anything else you want to add to this, Mathias, before we wrap this thing up?
Yes. And if you do contract the STD, just going back to the medical part, make sure that you take your antibiotics in full. Make sure that you complete your treatment, because a lot of the reason why we have granuloma lymphomat is because in the LGV is because the body has mutated these STDs and they're getting drug resistant. So a lot of times people aren't getting the same treatments anymore because the medication's not working on the virus. The viruses are mutating and making more new strands of that virus, which is causing them to become flesh eating, and is causing them to become antibiotic resistance in everything. So it's not always good to get an antibiotic for things, but if you do get an antibiotic, make sure that you take it through and follow your instructions, because your body could become resistant to that medication, and then when you get the STD again or something like it, we won't be able to give you that type of antibiotic. We have to give you a stronger one, or sometimes there's not an antibiotic that can cure it, so we have to figure out what we can do from the next stage on. Right. So it's very important that you do follow your treatment regimen when you when you get treatment for the STDs. Also, you're going to say, well, why we didn't include HIV into this STD panel or this STD about STDs. We went in several conversations about HIV, but HIV is a sexually transmitted disease that does have different mutations and things like that. There are medications that we talked about in extensive previous podcasts about PrEP and PEP, pre-exposure prophylaxis, and post-exposure prophylaxis. So definitely check out our library on those. But if you do have questions about HIV and things like that, we're more than welcome to go into it. We could probably do a podcast about each and every single STD, as much information as we know. But we really just feel like HIV was one that is more that we needed to hone in on and give you that whole hour of the HIV. So there's a lot more that we haven't tapped into about HIV, but trust me, we're coming back with more and more about HIV and prevention. So we just want you to understand that's why HIV was not included into this presentation here.
Yeah, but like I said, we already did our separate one on HIV because we want to separate HIV from the other STDs, because the way we work with HIV, we just want to make sure we bring a greater understanding to it. So I want to give a shout out to everybody who check out our podcast. Shout out to Trinity. I appreciate you listening to the podcast, and everybody else who check us out. Please remember to share this podcast with as many people as possible. We want to make sure that we help people become the healthiest versions of themselves. Once again, we are available on our website at nmcpodcast.com. We're also on anchor.fm, Breaker, Radio Republic, Pocket Cast, Spotify, Google Podcasts, as well as YouTube. And go to YouTube, type in Neighborhood Medical Center, subscribe, hit that notification bell. That way, every time we drop a podcast, you will know about it. And like, comment, share, do all these things on every platform because we want to make sure that our people know what's going on. And we hitting y'all in the head with this, the best health podcast around. So that being said, I am Joseph Ward. He's the incredible Mathias Sweet, and we represent Neighborhood Medical Center Ryan White program. Shout out to Miss Steeple, Dr. Staples. And we'll catch y'all next time. Peace out.
Later, y'all.